Welcome to London, where over 8 million people share the city with an estimated 10,000 urban foxes. And whilst many of these foxes are starting to become more domesticated, yes, that really is me throwing a snowball to my neighbourhood fox. Road safety is still a major threat to these lovable species. It is believed that 60% of the fox population dies in road traffic accidents each year. However, let's have a look at how the skills of veterinary teams can prevent such fatalities. We've just had a call from a member of the public who have found a fox lying in the road nearby. There's no injuries or blood near the scene, but the fox isn't moving. The fox is still breathing, so they're going to bring it down to us. The vet is currently assisting with other cases. I'm first to see the fox and I begin triaging it. As foxes are wild animals, safety is top priority, and so I transfer the patient to a cat cage, place a dog muzzle over the mouth and wear gauntlets. I carry out a general assessment and take a TPR. Respiration rate is taken first before touching the animal, so that any stress from handling doesn't result in a falsely raised reading. I then use my stethoscope to check the heart rate, placing the stethoscope under the armpit region and listening for 30 seconds, whilst also taking a pulse rate from the femoral artery in the back leg. The heart rate is high, but the pulse feels weak and slow. The temperature is taken rectally, and I discover that the patient is hypothermic. I will need to assemble heat devices and warming equipment once I have completed my triage assessment. The patient is a young female, perhaps around 6 months of age. She is extremely lethargic and does not seem to be aware of her surroundings. We would normally expect foxes to be hyper alert and afraid when brought into a veterinary clinic, but this patient appears to be drifting in and out of sleep, perhaps even consciousness. As I wait for the vet to be free, I place the patient into an oxygen cage and begin to assemble equipment for intravenous fluid therapy. Once the vet arrives, they are happy to progress with the case, and they initially prescribe pain relief to be given intramuscularly, and we soon take the patient into the X-ray room. Here we take a few different views of the fox, looking for any fractures or areas of other trauma, for example, damage to the chest or bladder. Amazingly, there are no fractures. We carry out a quick emergency ultrasound of the chest and abdominal area, looking for things such as blood from internal bleeding. Again, the patient has been extremely lucky and nothing out of the ordinary is discovered. We conclude that the patient is likely suffering from shock, and so place them on fluids to ease this. If we have found there to be any major injuries, we would have assessed whether it was ethically right to treat the fox, or if it would be kinder to euthanize them peacefully. After just 4 hours of fluid therapy, pain relief and active warming, the patient is already much more alert and comfortable. I offer her some puppy food, as well as some water, and she has a few licks of the food almost immediately. Come morning, it is clear our patient is doing much better, and so we contact our local wildlife rescue, the Fox Project, who are happy to rehabilitate her. Charities like the Fox Project are invaluable in aiding the rehabilitation and release of wildlife, as vet clinics are often not set up to assist with their long-term care. If you are interested in finding out more about the Fox Project, please have a look at their website. They are currently raising money to build a new wildlife hospital. It is thanks to them that our young fox has been successfully released into the wild.